We're in chapter 3, medication aid basics. Okay. So slide 2 starts with pharmacology. Pharmacology is the first term that you need to know. So I will ask you to highlight that. Pharmacology is the branch of medicine that studies the uses and the effects of drugs. So, this course is going to go over types of medications, different forms, and then it's also going to teach you how to administer those forms of drugs. So, the whole branch or pharmacology is just the uses and the effects that the drugs have on the population. The next term, efficacy, deals with how well that drug works in improving health. So an example of that would be if we gave a antihypertensive medication, and the purpose of an antihypertensive medication is that it's going to lower the blood pressure. Okay. Anti is against, it's trying to stop something, it's trying to fix something, right? So when we give that antihypertensive med, efficacy deals with how well does that drug actually work to lower the blood pressure. Okay. Um, Side effects are just changes that are caused by medications that do not relate to its intended purpose. So side effects can range from mild to severe. Mild could be nausea, vomiting, diarrhea, itching, things like that, all the way up to severe, which is anaphylaxis. That term anaphylaxis just means a severe allergic reaction. And so, with that type of allergic reaction, it is very, very important um, that we get help, because what's going on with that is that their tongue is starting to swell up, their lips are swelling up, and so what that does is it starts to cut off their circulation, it starts to cut off their airway, excuse me. And so then that could lead to death if we don't intervene. So that is just mild side effects to severe. It's a severe side effect, such as anaphylaxis, usually we administer epi. People that normally know that they have severe allergic reactions, they keep EpiPens on their person. Okay. Pharmacodynamics deals with the study of how a drug affects the body. The drug affects our bodies differently. You and I can both take the same drug. Let's just say Benadryl. We're both taking Benadryl. The Benadryl may make you sleepy, but it may make me more excited to where I'm not sleepy, but I'm anxious or I'm nervous. It may make me tremble a little bit, but it's all about how that drug interacted with my body. Okay. Pharmacokinetics deals with how drugs are processed by the body, how they are broken down. And so drugs go through four processes. The first process that you need to highlight is absorption. So, with absorption, this is how the drug moves from where it is administered to the bloodstream. Where drugs are administered, you can take a drug by mouth, you can give an injection, you can apply a patch, you can apply cream. Okay. So where it is administered to the bloodstream, it makes it into the bloodstream so that it can be transported to wherever it needs to get to. Right. So after it is absorbed into the bloodstream, then it has to be distributed. Okay. So once it's distributed, it's in the bloodstream now, and then now it has to go to the tissues of the body. Okay. So that's distribution. The step after distribution will be metabolized. Okay, so this is how a drug is broken down by the body. We have to keep in mind that everyone has a different metabolism, whether somebody has a very high functioning metabolism or someone has a very low functioning metabolism. When it comes to drugs, and the person that has a very high metabolism, they're going to break down that medication a lot quicker than somebody that has a low metabolism. So when we're administering meds, especially narcotics or anything that's going to sedate someone, We keep that in mind. A lot of our clients that we are administering meds to is geriatric, so they're older. Okay, so majority of them, their metabolism has actually slowed down, which means that it's going to take them a bit longer to process that medication, and then whatever the body does not need, it has to get it out of the body through excretion. Okay, so just for an example, so it can all make sense, we can give a Percocet or hydrocodone, whatever, morphine. We can give that to someone that has a high metabolism and someone that has a low metabolism. The person with the high metabolism, they're going to metabolize it a lot quicker. They're going to feel the effects and then it's going to wear off. Okay. And a person that has a low or slow metabolism, they'll take that medication and they will feel the effects a lot longer than someone that has a high metabolism and it's being processed out of the body slowly. So, what could possibly happen if we're not careful, if one of our residents and we're walking, if they're already sedated, meaning that they're already still sleepy and groggy because they're under the effects of the medication, be careful with administering another dose. I know that things are on our MARs, our medication administration records, but just because it's on the MAR, it does not necessarily mean that you are to administer those meds. If you feel a gut feeling like, I don't think I should administer this medication. Listen to it. Okay, listen to it. Go and report your feeling to your nurse and y'all talk it over. Okay, because that gut feeling could save your patient or save your resident. Okay, so just keep that in mind. Just because it is on the MAR, it does not mean that you have to give it. If you went into the room and you gave a Percocet at 8 a.m. and then your MAR tells you to go back at 12 to just an example, to go back at 12 to give another dose, and then you walk in and you see your patient or your resident is still sleepy, they're still out of it, I would not suggest giving that second dose, because when are they going to ever wake up? The effects, they're still feeling the effects of it. Okay. And so when you're going in there, you're just following the MAR, your patient is sedated. What you're doing is you're stacking doses on top of each other. Okay. And it's accumulating. Remember that term, accumulation. It's accumulating in their system faster than they can actually excrete it. Okay. So they're going to feel the effects a lot longer. So just be careful with that. Okay. So we just discussed metabolism. And then the next term is excretion. We excrete drugs, we can excrete them in two ways. It can be defecation, we can do it through urination. Okay. So that's how our body gets things out that we do not need. That's how our body gets toxins out. Okay. So those are the four processes that drugs go through. It has to be absorbed, it has to be distributed, metabolized, and then whatever is not needed, it is then excreted out of the body. Okay. Now we're going to skip over to slide 11. And when I tell you the slides, the numbers are right here under each box. Okay. So slide 11. Now we're going to start talking about liquid medications. Okay. The first one is an aerosol. So an aerosol is just a fine spray or mist, and it contains particles that are suspended in a gas. The next one is droppers. Drops is a very small amount of liquid given by a dropper. Now, a lot of our medications may come with a dropper or a syringe, okay? Just like this liquid suspension, amoxicillin suspension, it comes with a syringe, okay? And then it tells you on the bottle how much you want to give that person, okay? 10 mLs. And so whatever the syringe that comes with it, you have to use it, because the liquid that's in this bottle has been calibrated to the measurements of that syringe. So if I lose this syringe for whatever reason, I need to make sure to contact pharmacy. Okay, either I contact pharmacy or my nurse contacts pharmacy. I cannot switch over and use this medication cup, okay? Because you can overdose your patient or you can underdose them, okay? So if that liquid medication comes with a dropper, you have to use the dropper that comes with it, okay? The next, and you need to highlight drops, okay? The next term you need to highlight is elixir. Elixir is a thin, clean flavored liquid and it often contains alcohol. I used to tell students, to me, elixir sounds like liquor a little bit. So if that's the way that you can remember it to remind you it has alcohol in it, I would go with that. Spray is a liquid that is pushed through the air in tiny drops. It may be sprayed into the nose or onto another body part. So an example of that would be our nasal spray here. Okay, nasal spray. So we will always want to make sure that we shake this up before we actually administer it. Okay. All right, next slide. We're talking about solutions. Okay, a solution can be a solid, liquid, or a gas that's dissolved into a liquid. The first solution that we're going to discuss is suspension. You need to highlight that. So, suspension is a liquid mixture containing drug particles, and those drug particles are not completely dissolved. So, with all suspensions, you must shake it. Okay, and it's going to let you know on the bottle if it is a suspension. This is oral suspension, so I know that I have to shake this bottle well. Okay, if I do not shake this bottle, my patient is not getting the accurate dosage, they're not getting the right medicine. Okay. And me not shaking a medication that is supposed to be shaken, that's negligence. Negligence is carelessness. That's a term you need to remember. Negligence is carelessness. It means that I knew what to do, I just didn't care enough to do it the correct way. Okay. So, suspensions, your, what else? Your inhalers, they need to be shaken before every administration. Okay. Syrup is another one that you need to highlight. This one should be easy. Syrup is a medication in a solution of sugar and water. It can be with or without flavor. Okay. Tincture is an extract. These are usually more potent. Okay. And it's a plant material. Skip over to slide 13. Highlight this statement here. Advantages of liquid medications include ease of swallowing, rapid digestion, and absorption. Okay. If I'm having a resident that is having swallowing difficulties with their pills, we could talk with the nurse, and the nurse can probably speak with the physician and let them know, hey, they're having some swallowing difficulties. Maybe her form of medications need to be switched from pills to liquids, or maybe we need to crush the medication. But liquid medications are for easier swallowing. They absorb faster because there's nothing to be broken down, right? There are some challenges with having liquid medications on the cart, proper storage, because some medications need to be refrigerated. So if it's not refrigerated, that's going to mess up the medication. Measurement, if it's not being measured properly, okay, you can give somebody too much or too little medication. So you always want to make sure with your liquid medications that you are measuring it at eye level. You are not to hold the cup up and pour in the medication. You are to sit it on a flat surface, pour in your liquid, and measure it at eye level. Okay. All right, go over to slide 14. All four of these terms here on this slide you need to know. So we'll highlight each one. A tablet. A tablet is a form of medicine that is pressed into a hard pill. Okay, so we have just regular tablets. On your exam, it may be worded as powder pressed into a hard pill. Okay. Scored. When a medication is actually scored, it has a line on it. Okay. It is marked with a groove, and it's so that we can actually split the medication. Okay. So this here This medication has a line on it. So this is the only medication that we are allowed to split in half. And it's going to give us two equal doses. Okay. It's going to give us two equal doses. So if the physician say, hey, I want to start them on a smaller dose, I can split this pill in half and give them one half, and that'll be the smaller dose. Or if the physician says, I want to give them a larger dose than normal, I can give them this whole pill and then I can split another one to make up the larger dose that he prescribed. Okay. But again, these are the only pills that can be split in half. And when you are splitting them in half, you're going to use a pill splitter. Some of them look like this. I have some that look like this. Okay. It doesn't matter what it looks like. Okay. You just find the razor blade in here. Okay. So your razor is here, okay? And then you're going to sit your peel here in your little triangle and make sure to line this scored line up with the razor, okay? So mine is lined up. I'm going to close it and make sure it snaps. And so now you should see there's two halves in there that I can give one dose to my resident, discard the other one. When I say discard, I mean throw away if I no longer need that dose, right? But you follow whatever your facility's policy is regarding how to dispose of the other half, okay? All right, let's look at dosage. So dosage is the amount of medication to be taken at one time. So if my order says administer metoprolol 12.5, that 12.5 is the dosage. She's going to take one tablet of the 12.5. That's the dosage that she's going to take at one time. Okay. Enteric coated tablet. Enteric coated tablets have a protective film around it and it protects it so that it's able to pass through to the stomach before it becomes active. One of the most notable enteric coated tablets is aspirin. Aspirin eats away at the stomach lining. So it'll have that enteric coating on it. And this is an 81 milligram aspirin. You'll see the 81 like this instead of 18. 81 on there. And again, it eats away at the stomach, so it needs that protective coating on there. Now, since we know that it's for protection, we need to also know that we are not to ever crush enteric coated tablets, okay? Because if you crush your enteric coated tablets, then you just lose the protection, and then what's the point of that, right? So you never crush your enteric coated tablets, okay? All right. Your next slide. Film coated is just a tablet that's coated with a thin film to mask an undesirable taste for easier swallowing. And then we have caplet. That is an oblong tablet with a smooth finish. This right here is a caplet. Okay. It's oblong, oval. It has a smooth finish on there. Okay. And then we have a chewable tablet. Examples of your chewable tablets is your Tums or your gas relief, which is simethicone. They chew these. They don't swallow anything like that. They chew it. Okay. So my suggestion is when you're giving meds, put these chewable tablets in a separate medication cup away from their other pills. Okay. That'll remind them to chew the medication. Okay. Put that back some. All right. All right, oral disintegrating tablets. So, oral disintegrating tablets, if you break down that whole name there, oral is the mouth, disintegrating means that the tablet is simply dissolving. That's it. Now, there are two ways that you place an oral disintegrating tablet in the mouth. You can't just throw it in the mouth and say, have at it. There's two ways, okay? So the first way is sublingual. You'll see that on your next slide. Sublingual means under the tongue. So if my patient, for an example, is having some nausea and vomiting, we can administer Zofran. Zofran is usually a tiny pill, and then we put it under their tongue, and it'll dissolve because of the mucous membranes, the saliva, and the enzymes, right? It began to break it down and absorb it into the mucous membranes. So we can place that tablet under the tongue. Another way that we can place an oral disintegrating tablet in the mouth is buccal, and that's between the cheek and the gum. Okay, so you need to know both of those terms. Okay, an effervescent tablet. These tablets, once you place them into liquid of any sort, it will begin to release bubbles. Okay, um, an example of that would be Alka-Seltzer, or one that is actually not a medication would be your denture tablets. If you ever perform denture care on a resident and then you use their little cleanser tablets here, you place it into the water, and even on the back it shows you. Place it into the water and then it release those bubbles of carbon dioxide. Okay. Powder, you need to know this one as well. You need to know all four of these terms on slide 16. Powder, I want you to remember talc base, TALC base. Okay, talc base. Powders, okay, they can be applied externally, even though my powder is actually talc free, which is supposed to be good, right? The main thing that we need to know about powder is how to apply it appropriately and correctly. Okay, we never just want to shake the medication, the powder onto the resident, because our resident could have asthma or allergies, and we can trigger it because usually when you use powder, it'll have that fume or that, mist that comes out, right? So the appropriate way to apply powder onto my residents so that I do not cause any type of reactions, I need to have my gloves on. I need to pour the powder into my gloved hand and then apply it to my resident. Okay, that is very, very important. You'll see that question. Okay. Slide 17. A capsule is made of hard or soft gelatin. It has powder. It can have seeds in it, like granules, or it can have liquid in it. The tablets that we have for today has actual powder in them. Okay, you'll see that hard or soft gelatin. So if I have a resident, because you do not crush capsules, so you need to write that beside that. You don't crush those. So if I have a resident that receives crushed medications, all I have to do is open up the capsule. Okay, open it up, and then I can just pour out the contents into the pudding, into applesauce or whatnot, and then I can discard these capsule however my facility tells me to. Okay. All right, a lozenge, as we know, is just a cough drop. Okay, you need to know this term here as well as capsule. You need to know all four of these terms on slide 17. So lozenge, just a cough drop, hard candy, right? But it has a cousin. The cousin is called a troche. And with that, the difference is that the cough drop or the lozenge is hard. The troche can have a gummy consistency. Remember that. Okay, gummy consistency. All right, so we have controlled release. So these medications are designed to release over a period of time. Now, with controlled release medications, let's just say we're giving Mucinex, and this Mucinex dose is supposed to last the resident for 12 hours. One dose is supposed to provide mucus relief for a period of 12 hours. So if I administer that dose at 8 a.m., That dose will last them to 8 p.m. That's a full 12 hours. Now, if I crush and control release medication, that resident will receive that whole 12-hour dose because remind you, it's releasing a little bit of medication throughout the whole day. If I crush that control release medication, they're going to receive the full dose at one sitting, and it's not going to last them for 12 hours. Okay. With that, they're going to receive that whole dose in one sitting, but guess what? They still have to wait till 8 p.m. before we can give them another dose because that is what the order stated. Okay. So you always want to be mindful of that, to never crush, control, release. So I want you to write that next to control, release. Okay. Now I want you to skip over to slide 19. We're talking about topical medications. So topical medication is a medication route in which the drug is applied to a body surface. So ointment. Ointment is a semi-solid medication form that is thick, is greasy. I want you to write that is oily as well. So an example of that would be your triple antibiotic ointment. Okay. That would be your example. Okay. Cream is the next one you need to highlight. Cream is a medication that is for soothing and moisturizing ingredients. An example of that would be A&D cream. So put that on their bottom to protect against pressure breakdown, sores, things like that. The next one is a lotion. You know that is similar to a cream, but it's going to be thinner. I want you to write it's going to have a watery consistency. Okay. The next term that you need to know is paste. Paste is going to be thick, it's going to be stiff, and it's going to be mixed with a non-greasy base. Thick and stiff. So we need to keep that in mind. Usually the paste we'll put on their bottom, like Sensicare, which is another barrier cream. It is thicker. It is thicker. So just keep in mind, whether when you're applying any type of these topicals, okay, whether it's ointment, cream, lotion, paste, a thin layer will do just fine. If we're applying globs of medication, we're only wasting the medication. That's it. We're just wasting it. Okay. So apply a thin layer, because if you apply too much paste and it hardens and you come back in and just say you're trying to clean them or get the paste off of their bottom, you could actually cause them to have a skin tear on their bottom because it's going to peel their skin off. So apply a thin layer. All right, let's look at slide 20, suppository. You need to know this one as well. Suppository can be cone shaped, and we can insert them into the rectum or into the vagina. If we're inserting them into the rectum, it's probably a laxative for constipation. Okay. Or it could be a Tylenol suppository because our hospice resident, they're not alert, they can't take meds by mouth, but they're experiencing a fever, and we got to bring that down. So we'll give them a Tylenol suppository. Okay. If we give a suppository vaginally, it could be for yeast or it can be for moisture purposes. Right. Liniment. Liniment is a semi-solid or liquid medication form that is typically prepared with oil, and it contains pain relieving medication. Okay. When we look at patch, patch is a semi-solid form. We put it on to our residents. And so with the patches, you always want to make sure always want to make sure to put your name or your initials, excuse me. You put your initials, you put the date and the time. Okay. So on your patches, you always, and you have to remember this, there's three things that you have to apply to your patches. The date, time, and your initials because you are the one that is applying the patch. Okay? Remember that. Now, when we are applying patches, you always want to make sure to have your gloves on because you can absorb whatever is on this patch. So you have your gloves on when you are removing the old patch and when you are applying the new patch. Okay, always remember that. And also, you always want to rotate sites. So if you find the patch on the left arm and when you're about to apply the new one, put it on the right arm. Okay. The only time that you do not rotate sites is if the order tells you. Okay, so the order will tell you place patch on left hip. Okay, but if the order doesn't say where to place it, you always rotate sites. Okay. All right, so we're going to skip over to slide 22. So a prescription drug is what a physician writes out to us. We have to have a prescription to go and pick it up. Okay. And then there are over the counter drugs. Over the counter drugs mean we don't need a prescription to pick it up. We just go onto the aisles of the store and get the med off of the counter or off of the aisle. Okay. In nursing homes, assisted livings, medical facilities that provide medication assistance, they will have over the counter medications, and that's usually your vitamins, your Tylenols, your Advils, creams, different things like that. They will have those, and anybody can use those medications, but we have to have an order. Okay, so for an example, Tums is an over the counter med. So if I have 5 residents that all have an order for Tums, I don't need to have 5 individual bottles. Okay, because it's an over counter med. I can administer each dose to those 5 residents out of this one bottle. Okay, because it's an over the counter med, but they have to have an order. Okay, they have to have an order. Over the counter meds, if you are the one to break the seal on the med, always date it. You date it because your pharmacy is going to send you a list of expiration dates for medications. And it may say Tums expires 45 days from the date open. But if you don't put the date on there of when it was open, how do you know it's been 45 days? So always date your over-the-counter meds when you open the seal. Okay. We are looking into generic versus brand names. Your generic name deals with the chemicals. Okay. The brand name is just a name that is used for marketing that ties it back to a company. So, so just for an example here, these are 2 different brands. Okay. This brand name here is Excedrin. Excedrin is tied back to a particular drug manufacturer. Okay. Now, just like this Equate is tied back to a different drug manufacturer. But if we do some investigation, okay, so this is more of a brand, right? Big brand name that we know. Okay. If we do more investigation and we turn these bottles around and read the ingredients on there, I'm going to show you the ingredients first. So let's take a look at the Excedrin big name brand bottle here. Here are the ingredients. Let's see if it'll focus. So if you can't see that, The ingredients are acetaminophen 250 milligrams, aspirin 250 milligrams, caffeine 65 milligrams, and that is the Excedrin bottle. Big name brand, right? Let's look at the Equate version. Okay, let's read the ingredients. Ingredients: acetaminophen 250 milligrams, aspirin 250 milligrams, caffeine 65 milligrams. So you say, Miss King, that's the same exact ingredients. Correct. Correct. They are selling you the same drugs, the same ingredients. The brand name is different. That's it. Just comes from different companies. Your brand name is always going to be easier to pronounce and it's going to be shorter and you're going to see it on the commercials. And again, the generic names deal with the chemicals that make that drug up. Okay, so that is an example. If this, let's just say, for an example, there's 100 tablets in here, same ingredients, and we're going to say there's 100 tablets in here too. This Excedrin bottle may cost you $8. This Equate bottle for the same amount of tabs, the same ingredients may cost you $4. So the price points is different. Okay, but they're the exact same ingredients. They're going to work the exact same way. Okay, so that is the difference between generic and brand name. Okay, now I want you to skip over to page 29 or slide 29. All right, so we're going to talk about routes of administration. The different routes are just how we get medication into the body. All right, the first one is the most common route, the oral route. Mostly everyone takes their pills by mouth. Majority of people, not all, but majority of people take their pills by mouth. The next route is injection. So now we're using a needle of some sort. So we have different types of needles. Okay. So we're doing any type of injection, whether it's insulin injection, whether it's just a regular med that we have to give that's not insulin. Okay, we'll use a needle for that. The first type of injection is an intradermal. If you've had a TB test done, a skin test on your forearm here, and they'll inject it, you'll see a little bleb, and then they'll circle it. That's an intradermal. It goes right under the first layer of the skin. Then we have intramuscular, where the injection is going into the muscle. So it's going into here. And then we have IV. IV is not in your scope of practice, and you need to be aware of that. Okay. So that is going directly into the veins. Okay. That is not in your scope. Rectal route is self-explanatory as well as vaginal route as well. Okay. The next route, and these next two I want you to highlight. Ocular, like binoculars, we use those to see, right? So for the ocular route, this is the eye route, okay? So we're giving eye drops, things of that nature. Otic route, okay? This is the ear, so we're doing eardrops. Nasal route, inhalation route, those are both self-explanatory, as well as nebulizer route. Then we have topical. Again, that's your creams, ointments, paste, things like that. And transdermal is how we apply patches, which is across the skin. Okay. Let's see. And this is just a question that I like to ask. And we're on slide 44. Regarding undernourishments. Just a little question. Um, if I have a 70-year-old white female. She is 100, or no, we're going to say she is 90 pounds. Okay. And then we have a 70-year-old white female that is 400 pounds. Which one of them are undernourished? I give you a chance to think about that. Is it the 90 pound? Is it the 400 pound? Mm, 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 mm. If you said both, you are correct. It is both of them. The 90-pound young lady or 90-pound older lady, she's not getting in enough calories, right? Or she could have some sort of eating disorder, right? The 400-pound, they're getting in calories, but they're not the healthy calories. Okay, so their calories is probably coming from fast foods, things of that sort. Okay, so they're both undernourished because undernourished means that they are lacking appropriate nutrients. Okay, so that was just a trick question for you right there. But that is all of chapter 3. As you see that Miss King skips through because these slides do repeat. So that is the end of chapter 3. Okay.